Do you feel like yeast infections have taken over your life? You treat one, and before you know it, it's back again. If this sounds familiar, you're not alone. And I'm here to help. Chronic yeast infections aren't just frustrating, they can seriously impact your daily life and confidence. But the good news? There are solutions. Hi, welcome to today's video where we're diving deep into the world of chronic yeast infections. Why they keep coming back, how to spot the signs, and most importantly, how to treat and prevent them effectively. Whether this is your first time experiencing this issue or you've been struggling for years, understanding the root cause is the first step to finding relief. So grab a cup of tea, get comfortable, and let's tackle this together. But wait, before we begin, please subscribe to ensure that you never miss out on any of my essential stuff. Comment, "I subscribe," below, and I will personally welcome you to our community. With that said, let's get started. Yeast infections are caused by an overgrowth of a fungus called Candida, which is naturally present in our bodies. While Candida is usually harmless, it can multiply uncontrollably when the balance of bacteria and fungi in your body is disrupted. This leads to the uncomfortable symptoms of a yeast infection. Although yeast infections are most commonly associated with women, especially vaginal yeast infections, they can affect anyone, including men and children. Areas like the mouth, oral thrush, skin folds, and even the digestive system can also be impacted by yeast overgrowth. Yeast infections are not usually dangerous, but can become persistent and chronic, significantly affecting your quality of life. If you've been experiencing recurrent infections, it's essential to understand the possible causes and seek appropriate treatment. Common triggers. Chronic yeast infections often result from factors that disrupt the body's natural balance. Hormonal imbalances, such as those experienced during pregnancy, menopause, or while taking birth control, can create an environment conducive to yeast overgrowth. Antibiotics, though helpful in treating bacterial infections, can also eliminate the good bacteria that keep Candida in check. Poorly managed diabetes is another significant trigger, as high blood sugar levels can feed yeast growth. Additionally, a weakened immune system, whether due to stress, illness, or medications like corticosteroids, can leave your body vulnerable to recurring infections. Lifestyle factors. Everyday habits can also contribute to chronic yeast infections. Wearing tight, non-breathable clothing or synthetic underwear traps moisture, creating a perfect breeding ground for yeast. Poor hygiene practices, such as not changing out of sweaty clothes or using heavily scented soaps, can disrupt your body's natural defenses. Diet also plays a role. High sugar and high carb diets can feed yeast and promote overgrowth. Underlying medical conditions. If yeast infections keep returning despite treatment, they may point to underlying health issues. Conditions like autoimmune disorders or even undiagnosed sexually transmitted infections, STIs, can weaken your defenses, making you more susceptible to infections. Signs and symptoms. Typical symptoms. Yeast infections can cause intense itching, redness, and irritation in the affected area. Vaginal yeast infections, for instance, may lead to thick, white discharge resembling cottage cheese. You might also experience a burning sensation during urination or sexual intercourse. Chronic infection signs. Chronic yeast infections are characterized by recurring episodes, typically 4 or more infections in a year, or symptoms that persist despite standard treatment. This is often a sign that the root cause hasn't been addressed, or that the infection has become resistant to treatment. Treatment options. Over-the-counter OTC remedies. For mild to moderate infections, OTC treatments like antifungal creams and suppositories, e.g. miconazole, clotrimazole, can be effective. Oral antifungal medications like fluconazole are also available and may provide relief for more severe cases. Prescription treatments. For chronic or resistant infections, doctors may prescribe extended antifungal regimens or higher doses of medication. Probiotic supplements can also help restore the balance of healthy bacteria in your body, supporting long-term recovery. Natural remedies, with a disclaimer. Some people find relief using natural remedies, like yogurt or probiotics, which help replenish good bacteria. Coconut oil and tea tree oil have antifungal properties, but should be used cautiously and under the guidance of a healthcare provider. When to see a doctor. If your symptoms persist or worsen despite treatment, it's essential to consult a healthcare provider. chronic yeast infections may require specialized care, and they could be a sign of an underlying condition that needs attention. Prevention tips. Lifestyle changes. Preventing yeast infections often starts with simple lifestyle adjustments. Wear loose, breathable clothing and cotton underwear to reduce moisture buildup. Practice good hygiene, especially after exercising, and avoid using harsh or scented soaps in sensitive areas. Dietary adjustments. Limiting sugar and refined carbs can help starve Candida and reduce its overgrowth. Incorporating probiotics into your diet through yogurt, kefir, or supplements can promote a healthy balance of bacteria. Health monitoring. Managing chronic health conditions like diabetes is crucial in preventing yeast infections. Strengthen your immune system with a balanced diet, regular exercise, adequate sleep, and stress management to reduce your susceptibility to infections. In conclusion, chronic yeast infections can be frustrating and disruptive, but understanding their causes, recognizing the symptoms, and taking proactive steps toward treatment and prevention can make a huge difference. Remember, your health is worth prioritizing, so don't hesitate to seek medical advice if you're struggling with recurring infections. With that said, thanks for watching. Hit that like button, subscribe, and share your thoughts or questions in the comments. And until next time, stay informed, stay healthy, and take care.